Hi, my name is Dr. Kevin Shih. I'm an internal medicine geriatrics physician with WellMed McDermott in Plano, Texas. Today we'll be talking about back pain. Yeah, back pain is a very common problem primary care doctors will see in clinic. It can cause debilitating pain as well as missed days of work. Some of the estimated costs from back pain range from $100 billion a year to $200 billion a year, including disability, lost productivity, medications, surgeries, lost income. So definitely it is an issue that can seem very minor, but at the same time cause a lot of repercussions. Yeah, so a lot of times patients will ask what can help with back pain or if they need to do a surgery. It really depends on factors of the patient, what they were doing. If it was related to just some sort of lifting or twisting, a lot of times conservative management is sufficient, such as using ibuprofen or Aleve, heating pads. Those should usually resolve in a few days, maybe up to a week. Other things that maybe require more examination or further digging maybe require falls. If you have some sort of fall or injury, always making sure there's no fracture, especially in the elderly who may have osteoporosis. If the back pain is very severe or they have neurological issues such as inability to walk or stand, inability to move their legs or control their bowel or bladder movements, that may require some sort of imaging to assess for possible nerve impingement or nerve damage. If people have sciatic pains, that typically does not require surgery. Usually therapy and conservative management can help with that. If the sciatica pain does not resolve, sometimes pain doctors or spine doctors can do injections to relieve inflammation of the sciatic nerve. Yes, that's a good question. Patients can sometimes have trouble differentiating the different causes of back pain. If it feels more tightness or a pulling sensation, especially with twisting, that may suggest more of a muscle strain. If there is very severe pain and neurologic symptoms, that may suggest a herniated disc or possibly some sort of impingement. If there's a compression fracture, that may just present as very severe pain. Sometimes those will be a little bit more difficult to differentiate without imaging. Sometimes if bending a certain way, you feel tingling down the leg, that may suggest a compression of the nerve. So definitely it depends on what happened, what precipitated the pain, and what findings the physician finds on examination. Depending on the person's body and their habits, different sleep aids can help with relaxing the back and reducing strain at night. Some people prefer a harder mattress, or some people prefer softer mattresses. Really depends on their body frame and their habits. You just want to make sure you have something comfortable that relaxes your back, won't lead you to strain your back. Some people also like a heating pad if it gets cold at night or the mattress is cold. A little bit of heat can help relax those muscles and joints as well. Some people may prefer to sleep on the side or use a body pillow to hug. Sometimes putting a pillow between the legs also helps prevent hip pains and also back pains. People with sleep apnea may also have trouble getting comfortable sleeping on the back. So definitely, if you have trouble sleeping, may want to assess for any sleep apnea. I wouldn't say there's any set tool or aid. I'd recommend just whatever feels comfortable for you, and let your body relax without being too stiff. So for maintaining good back strength and posture and maintaining good core strength, I would recommend just light stretching at the minimum to make sure you have good range of motion and make sure you're able to bend and flex certain ways. Other activities such as yoga are good for range of motion and help reduce injury by making sure you're able to do certain motions. Tai Chi is another good one, which can help build core and range of motion. And then if you really want to strengthen the muscles, maybe doing some core building such as crunches or bodyweight squats, maybe doing some planks if you're able to, and side planks. And those can really kind of tighten the back and muscles and the abdominal muscles as well. Yeah, so massage therapy would be good for any muscle strain or tightness. Massage can break up some of those tight muscles, help with relaxation. If it is related to more spinal issues or bone issues, massage may not help as much. In that case, definitely maybe seeing a spinal surgeon before doing massage may let you know if the massage will help. Same thing with chiropractor. Certain chiropractors may help with light pain or light degenerative back issues, but if it is very severe, maybe seeing a doctor or a orthopedic spine doctor can let you know if those things will be beneficial. Yeah, so a lot of people who do, a lot of athletes who do high impact sports such as football or jumping and running a lot, that can lead to muscle strain and over time lead to some degenerative changes. A lot of times when you're younger, you can kind of get away with it. The back will kind of recover, but over time those will lead to maybe bone spurs, some degenerative arthritis, some disc degeneration, and that can overall lead to chronic pain that you can experience once you're in your 60s and 70s. I used to do a lot of weightlifting and exercises, so I went to the gym and did some deadlifts, and sometimes if you don't have the right posture or you lift too much, you can sometimes strain the back. It didn't result in any significant damage. Now other people who lift a lot heavier weight or who are power lifters, they can sometimes lift too much weight and have a disc herniation, which is pretty common in weightlifters. Basically the weight is stacked onto the spine and kind of pushes one of the discs out into the spinal canal and can sometimes push on the spinal cord, and that will cause sometimes nerve pain and sometimes weakness. If that should happen, you should get checked out, possibly do some imaging. A lot of times if there is a disc herniation, it can be treated non-surgically with medications, such as ibuprofen, some therapy. If the pain persists with tingling and weakness, sometimes they might have to do an MRI and possibly do a procedure to repair the disc herniation. Yeah, so if back pain is persisting or feeling abnormal or having atypical symptoms such as neurologic pain, weakness, or inability to get up or use the bathroom, if there is a precipitating factor such as a trauma or accident, definitely seek out a medical professional, which may require imaging and further examination. We hope this video has been helpful. If you want to see more videos, please click on our YouTube channel to see more videos from our clinicians.